So we've looked at the absorption of sodium, water, secretion and absorption of bicarbonate and chloride ions. Now moving on to potassium. Well, potassium is passively absorbed in the jejunum and ileum, and it's secreted in the colon. First of all, looking at absorption, it's absorbed in three ways. It's absorbed paracellularly, so that's via tight junctions. It's absorbed passively, and it's also absorbed by something called solvent drag, so that's when water enters the body as a result of lowered water potential from sodium and chloride absorption. It also pulls in potassium by solvent drag. Like I said, potassium is secreted from the colon via potassium channels, and as I'll talk about in a second, it's stimulated by aldosterone. So remember I said that aldosterone, it inhibits sodium and chloride absorption, but it stimulates the secretion of potassium from the large intestine. So let's have a look at that. So what happens is that, you remember this channel that I mentioned on the basolateral side, the sodium potassium ATPase. So that pumps 3 sodium out and 2 potassium in, and the potassium is then secreted from the colon via these channels, via potassium channels basically, and it's stimulated by aldosterone, CAMP, and calcium. You can regulate the absorption and secretion in the small and large intestine by external regulation, and this comes in the form of absorptagogues, which stimulate absorption, and secretagogues, which stimulate secretion and inhibit absorption. And if you inhibit absorption, then water is going to have a low water potential in the lumen. Water is going to move into the lumen, it's going to cause diarrhea. First of all, looking at absorptagogues, the two absorptagogues that stimulate absorption of ions are angiotensin and aldosterone. And what they do is they act on sodium-hydrogen and sodium-hydrogen exchanger, as well as sodium channels, remember the ENaC channels in the colon, to increase sodium chloride absorption and retain water. So let's have a look at how that works. Well, dehydration stimulates the RAS system, and the RAS system, what that is it's the renin, angiotensin, aldosterone system. So I'll quickly talk about that. Well, basically, renin, angiotensinogen, is produced in the liver. It's then activated in the kidney by an enzyme called renin to become angiotensin 1. Angiotensin 1 is activated, or it's converted to angiotensin 2 by angiotensin converting enzyme ACE. So angiotensin converting enzyme converts it to angiotensin 2. So this is here. So dehydration stimulates the RAS system, creating angiotensin 2. And angiotensin 2, what it does is, first of all, it directly stimulates the sodium-hydrogen exchanger. And if you remember the sodium-hydrogen exchanger, it's the second method by which sodium is absorbed into the body and hydrogen is pumped out, right? And that's the first thing angiotensin does. The second thing angiotensin does is it activates, or it stimulates, the secretion of aldosterone from the medulla. From the adrenal medulla, and what aldosterone does is it stimulates the ENaC sodium channels in the colon, by which sodium is absorbed into the body from the colon. So the overall result of these two absorptagogues is increased sodium and chloride absorption into the body. So now moving on to secretagogues that stimulate secretion and therefore result in diarrhea. There's 4 types of secretagogues that you need to know about. There's bacterial enterotoxins such as cholera. There's hormones and neurotransmitters. There's immune cell products such as histamine, and there's laxatives. And these, what they do is they elevate CAMP, which has 2 effects. It inhibits absorption of ions, and it promotes secretion of ions, and essentially this reduces the water potential of the lumen, causing water to enter the lumen of the gut, causing diarrhea. First of all, looking at bacterial enterotoxins, they're secretagogues. And this is how it happens. Well, if you have contaminated food or water, that contains the Vibrio cholerae bacteria, then what it does is it produces the cholera enterotoxin. This elevates CAMP, resulting in two things: increased potassium and chloride secretion and reduced sodium chloride absorption, which is going to lower the water potential of the body, of the gut, causing diarrhea, which is liquid stool, within 4 to 12 hours, and death in 18 days. So in terms of treatment, well, if you've got diarrhea, then you've got water obviously leaving the body, so you're going to need a rehydration solution, first of all. And secondly, because you're getting reduced sodium chloride absorption, you can use a sodium chloride powder. And this sodium chloride powder is part of the rehydration solution. So the rehydration solution rehydrates you and allows you to absorb sodium and chloride. The next secretagogue is hormones. And the hormone that's the secretagogue is called VIP hormone, vasoactive intestinal peptide hormone, right? And where does it come from? Well, vasoactive intestinal peptide hormone comes from a pancreatic tumor called a vipoma, oma implying it's a tumor, vipoma implying VIP tumor. So the tumor secretes VIP hormone. And what that does is that's called Werner-Morrison syndrome. The result of that is elevated CAMP, just like the bacterial enterotoxin, causing increased chloride and potassium secretion and reduced sodium chloride absorption, resulting in diarrhea. So if we can summarize that here, it's the pancreatic tumor called a vipoma, Werner-Morrison syndrome. It secretes the VIP hormone, stimulating chloride and bicarbonate and potassium secretion, causing diarrhea. Immune cell products can also be secretagogues, so let's have a look at that, how that happens. Well, if you have an infection, then mast cells, they deglutinate in an immune response. And this deglutination involves the production of histamine and prostaglandins. Remember, prostaglandins are part of the immune response. And what happens is that histamine and prostaglandin, they cause increased elevated CAMP, which causes diarrhea through the, by inhibiting sodium chloride absorption and stimulating potassium chloride secretion, causing diarrhea. And this infection, causing the immune response, will also result in inflammation. Now, if you think back to the lecture on the stomach acid secretions, you'll remember that histamine is secreted by ECL cells, right? So, essentially, to stop this immune response and prevent the secretagogue effect, you can use somatostatin, because what somatostatin does is it inhibits. You remember, somatostatin inhibits a lot of things. It inhibits acid secretion by acting on parietal cells. It inhibits acid secretion indirectly by acting on ECL cells and G cells. It also inhibits pancreatic secretion by inhibiting duodenal S cells and duodenal I cells. So it inhibits the ECLs also from releasing histamine, and you can use a somatostatin analog called octreotide. Another treatment for the diarrhea is loperamide. Now what loperamide does is that essentially it inhibits the myenteric plexus. My means muscle, enteric means intestine, so it's the plexus of nerves that controls the motility. And so by inhibiting that, it results in decreased motility. Why would you want to do that? Well, if the food is going through the gut more slowly, then there's more time for water to be absorbed, so you're less likely to have diarrhea. And that's summarized here. So immune response can also be a secretagogue due to the histamine and prostaglandin from the mast cells, and loperamide can reduce the diarrhea, as well as somatostatin analog octreotide inhibiting ECLs from producing histamine. Finally, laxatives can also be secretagogues, and there's a few types of laxative. So here a summary of a few types of laxative. There's bulk laxatives, methylcellulose, there's osmotic laxatives such as lactulose, and there's stimulant laxatives such as senna. So let's see how each of these work. Well, senna, the stimulant laxative, what that does is it irritates the colon wall and irritating the enteric nervous system, causing increased peristalsis. And if you increase the peristalsis, the food is going to be moving through the gut faster, causing diarrhea as a result. So senna, it stimulates the enteric nervous system, right? The next one is bulk laxatives, such as methylcellulose. So methylcellulose is a bulk laxative, and what that does is it's full of dietary, it's full of fibre. And what the fibre does is it loosens the stools, and it adds bulk to it, which also stimulates the enteric nervous system to allow ease of peristalsis, right? So essentially it loosens the stools. And finally, osmotic laxatives, such as lactulose. Well, lactulose, an osmotic laxative, it's fermented in the lumen, like the ulose, like glucose and galactose, it's a carbohydrate, and it's fermented in the lumen, making the lumen hypoosmotic. So therefore water will move into the lumen, causing diarrhea.